in 4 Americans have depression, yet only 20% get help, despite the increasing need for mental health support with the challenges we are facing today. Asking for help with your mental health is difficult, and I would know because that is my story. Hi, I'm Kavi, the CEO and founder of Rose Smarter Mental Health. Earlier in my career, I was working 80 to 100 hours a week in the finance industry. After 7 years working those hours, I finally burned out and I broke down. At that point, I experienced mental health care for the first time, and I realized then that the system can transform our health, but it is in dire need of help to adequately provide care to patients. From burning out to building up, I've launched Rose to transform mental health delivery. After analyzing the mental health landscape, we learned that primary care clinicians have a large impact on mental health. PCPs are seeing a growing burden of mental health concerns. Estimates suggest that around 80% of mental health care is handled by PCPs. These providers do their best, but are often left unable to do much more than prescribe a medication. In fact, less than 10% of PCPs are satisfied with the mental health services they are able to offer their patients. But until now, primary care clinicians did not get compensated for treating mental health concerns. With this problem in hand, Rose sells our product to physician groups who provide medication if needed and assigns the Rose app. The patient begins their journey of entering clinical assessments, checking in with their daily mood and anxiety levels, and journaling their thoughts and feelings. Rose then leverages our deep tech natural language processing system to detect semantic tones and push curated, targeted content for self care in the form of articles, audio recordings, and videos. The clinician sees all of their patient's information in real time and uses that data to conduct behavioral health integration, which is the monthly planning and monitoring of their patients. Importantly, clinicians can bill Medicare and almost all commercial insurance for behavioral health integration, which generates about $45 per patient per month in reimbursement revenue and about $72,000 in newfound revenue each year for practices that use Rose. Rose then bills the providers a flat fee for the product, allowing for a 10 times reimbursement return for each clinician using Rose. One of the main core competencies of Rose is our tech stack. We leverage deep tech to identify semantic tone and then use that data for the patient's appropriate care pathway. We are doing the same with speech and audio and video recognition of microfacial expressions. With such a solid and quality product, we have conducted a phase 1 IRB study where we saw favorable adults, where 79% of patients used the Rose platform every single day during the 5-week study, and 73% of patients improved with their depression scores within that 5-week window. With $7.7 billion addressable risk-bearing market, I'm excited to announce an enhanced new offering of Rose as the first end-to-end care patient mental health care experience that identifies symptoms early, connects patients to therapists, and provides actionable insights throughout the care journey. We now have access to about 80 care navigators who are clinical social workers or above, 15 psychiatrists, and 10 psychologists who can provide 24/7, 365 services to patients in need. Patients of risk-bearing entities like ACOs, employers, health systems, and health plans can access our Rose concierge team who will triage, assess, and create a care plan for the patient. The care team will perform short-term therapy and will then match the patient with a long-term therapist in less than 5 days. To be exact, 50% of patients will be matched with a licensed therapist within 3 days, and 98% of Rose users, you will be matched with a licensed clinical therapist within 5 days. This is a significant shift from the way mental health care is currently delivered. There are very few companies that can even get close to a month of being able to match a patient and get a patient an appointment. Rose now has the ability to get a patient matched with a therapist and actually be seen within 5 days. That is a significant change in the way mental health care is now going to be delivered. With this new model in hand and a solid team to execute on our milestones, Rose is delighted to announce that we'll begin our Series A fundraising in mid-August 2021 to expand the velocity of our growth. As we grow, we're looking for advisors and mentors, a full-time sales director, investors in our upcoming Series A, and risk-bearing entities to use Rose. We gladly would love to hear from those who are interested in learning more about us and being able to join the Rose team. Thank you, Startup Help, for having us, and we can open it up for questions.
Awesome. Thank you so much, Kavi, for a wonderful presentation.
Sure.
To kick it off, triaging a patient and scheduling an appointment with a therapist in 5 days is quite remarkable in this space. Can you sort of explain the patient journey for this process and the end-to-end solution you've created for mental health?
Sure. We begin the process by closing the physician or the PCP practice, being able to contract with them, and then we run an algorithm on the EHR that can identify patients who may be at risk or are at risk for mental health decompensation. Based on that, we would then invite the patient uh, to join the Rose app, and the clinician themselves would invite the patient either through email or text. The patient would then download Rose and use Rose for its self-help and mental well-being toolkit. The goal of Rose really is to build mental health resiliency, build coping mechanisms while in between sessions with your clinician. The Rose team and your clinician will monitor your progress. We do leverage remote patient monitoring and behavioral health integration, which allows us to see how a patient is progressing or, more importantly, regressing in care. We would then continue, the patient would learn more about themselves, identify triggers, and then they can determine, this is the most important part, the patient can determine whether they need additional help or if they would like to speak to someone for just basic counseling. In that case, they would call our Rose dedicated care concierge number, and we'll have a licensed clinical social worker or above available 24/7, 365 to provide uh, short-term therapy, coaching, clinical coaching, assessments, and then ultimately getting that patient an appointment with a live therapist within uh, a 5-day period of time. After that, we match the patient with a therapist, and then finally we follow up with the patient monitoring to ensure that the patient ha- uh, has a good fit with the clinician and is able to sustain their mental health with the resources that Rose is able to provide.
Got it. Awesome. So a couple questions have come in the chat. Who are your competitors in the space? Join, Reflect, and others. And then additionally, do you have matching services and scheduling?
Yeah. So, what was the last part?
The matching services and scheduling.
Sure. So, our main competitor is a company called Neuroflow based out of Boston. They have started their Neuroflow about 3 years prior to Rose. Um, we see them as the main competitor. However, our tech stack and our connection with Johns Hopkins, in addition to our evidence-based approach, really sets us apart from them. With the with the matching and the scheduling, we've partnered with an organization that will leverage our own matching algorithm. So Rose has created a matching algorithm to more efficiently manage a patient with a clinician. This ultimately allows for less waste in the system because with our algorithm, we can find the best clinician for that patient so that they don't have to wait another 5 days. In our case, even though 5 days is great, I mean, the industry average is about 90 days. So being able to get that patient with the right clinician based on demographics as well as cultural context.